we are going to illustrate cases of fluorescein angiography. As Dr. Hanan told us about the basis of fluorescein angiography, we are going to introduce fluorescein angiography in different vascular diseases. هنتكلم عن fluorescein angiography in diabetic retinopathy. When we are going, please, no, swimming pool, please. Okay, when we are going to describe fluorescein angiography in diabetic retinopathy, we need from the patient. We need to know from the patient fluorescein angiography changes in diabetes. To know the capillary bed dropouts or the macular edema and macular area to detect any new vascularization which may be present mainly on the disc and new vessels elsewhere. Okay? This is a case of a non-proliferative diabetic retinopathy, the color photo showing hard exudates, and the fluorescein angiography showing blocked fluorescence, which is coinciding with hemorrhages seen in the color photo, and showing the macular area with late dial leakage, causing macular edema. Also, this is a non-proliferative diabetic retinopathy with laser marks. This is a proliferative diabetic retinopathy due to the presence of NVEs in the periphery. This is a proliferative diabetic retinopathy with pre-retinal hemorrhages. This is the case if you see it without, if you see this case without this pre-retinal hemorrhage, you can tell that this is not a proliferative diabetic retinopathy. The only sign that telling us this is a proliferative diabetic retinopathy is pre-retinal hemorrhage, which is covering this NVEs. It couldn't be a peer, and it couldn't be tell us that is a proliferative diabetic retinopathy. This is a proliferative diabetic retinopathy with both NVEs and NVDs. This is the NVEs, and this is the NVDs, which is 1 disc diameter from the disc. This is also proliferative diabetic retinopathy with fibrovascular proliferations above the disc with late staining and early leakage. And this is the characteristics of new vascularization. New vascularization of choroidal neovascular membrane or new vascularization of the new vessels of diabetes is characterized by very early leakage. Okay? This is a fibrovascular proliferation as you see in the color photo here with laser marks, which is appear here in the fluorescein angiography. You can see this. This is the staining of the fibrovascular sheet. This is also extensive proliferative diabetic retinopathy, and this is, as you see before, it's called an end-stage diabetic retinopathy. About the macular edema and the ischemia, you can see how much the ischemic areas. Please concentrate in this because when we are going to discuss OCT angio, we will see these areas because this is a magnified picture of fluorescein angiography, which looks like OCT angio. Fluorescein angiography in vein occlusion, we need also to know if there is late filling of the veins or not. We need to know macular edema is present or not. Also, new vascularization is present or not. This is to know if it is ischemic or non-ischemic retinal vein occlusion. This is a branch retinal vein occlusion. As you see, upper temporal retinal vein occlusion with ischemic changes. You can see the ischemic changes here, and this is blocked hemorrhages. This is also central retinal vein. You can see all over the fundus and posterior bore hemorrhages with late leakage around the phase causing macular edema. Seems it is not ischemic. Okay? This is also central retinal vein occlusion with optic disc swelling with leakage. This is artery and vein occlusion together. You can see a fundus, and the arteries is not showing no fillings all over the procedures. But in the same time, there is hemorrhages, multiple hemorrhages. So in this time, you should suspect both artery and vein occlusion. This is a branch retinal artery. This is an artery occlusion, branch retinal artery occlusion of the right eye. You can see this area, which is called retinal whitening. And here is the platelet fibrin or the clot. This is also artery with, yes, this is central retinal artery with cilioretinal artery. Okay, you can see that the vessels is lately showing filling. It's not filled here, it's not filled here, but lately you can see this is called recanalization of the arteries. You know it? This is also a late phase of fluorescein angiography of a central retinal artery occlusion. Cystoid macular edema. This is a flower petal appearance of the cystoid macular edema. Cystoid macular edema, magnified picture. Macroaneurysm, as Dr. Hanan told us. Okay, thank you. This is the clot, and when you find something as very dense hemorrhages related to an artery without any history of diabetes, mainly hypertension, most probably in females, you should suspect macroaneurysm. This is also a macroaneurysm. This is a Valsalva picture. Ask the patient about the history. You may find the patient doing something like screening or watching a football game or something like that. Then you will discover that it is a Valsalva maneuver. This is the CSR. You will see just a very small dot which is increasing in size, in intensity mainly. Okay? Try to do OCT in order not to be confused with C and V. Okay, because CSR sometimes is confused with C and V by fluorescein angiography. Fluorescein angiography, but OCT will tell you that if it is CSR or C and V. This is a CSR by fluorescein angiography, but it is with multiple points. You can see it. You can suspect that it may be C and V. Yes, that's why you should confuse yourself. This is a CSR, but smokestack. Smokestack with umbrella, inverted umbrella, is much more easier than ink blot. This is the bull's eye. Ask the patient about the history of taking any drugs. Okay, the central area shows hyperpigmentation, then hypopigmentation, then hyperpigmentation. There is many differential diagnosis for bull's eye. Bull's eye away from the drugs also. This is a macular buccal, which can be shown by OCT with severe epiretinal membrane, but you can see it in fluorescein as the vessels is retracted and irregular that way. This is Stargardt. Stargardt disease is just an RPE atrophic change. You will see in the macular area fixed hyperfluorescent dot, not increasing in size but increasing in intensity, denoting RPE atrophic changes. This is also Stargardt. Fundus flavimaculatus also is RPE atrophic changes, so you just should see the configuration around the macular area for the disease to tell us, is it confused only to the fovea or it is all around the macular area. This is also fixed hyperfluorescent spots, not increasing in size but intensity, denoting RPE atrophic changes. This is what's called macular dystrophy. It is really apparent for infrared. Okay, most of the time, something like that. You see, and it is also RPE atrophic changes, not increasing in size. Most of retinal dystrophies is RPE atrophic changes, with the exception of those who are transmitted to C and V. Okay. This is inflammatory condition. Whatever the inflammatory condition, it may be associated with macular edema. So we are doing fluorescein angiography in inflammatory condition to know if the patient is associated with macular edema or not. This is a melanoma, but it is amelanotic. Okay? There is another circulation on the surface of melanoma, which is called, yes, double circulation. This is a case of drusen. Also, the drusen is RPE changes, unless this RPE changes is converted to wet type and the new vascularization is passing. So the RPE atrophic changes, changing from dry type to wet type, which is forming CNV. This is also drusen. Drusen is also fixed hyperfluorescent spots. You see this and this and this. You will not find any changes with the exception of increased intensity here only. But all the way as it is fixed and not increasing in size, don't be suspicious in CNV. Okay? This is choroidal neovascular membrane. You're showing very early leakage. You see this area, which is increasing in both size and intensity. Then you're going to be suspicious in CNV. This is also CNV, but it is surrounded by hemorrhages, which this is called occult CNV. Yes. You can't recognize the classic CNV, the classic normal CNV. This is a very huge CNV. Okay? How do you know that this is CNV? Try to do OCT. You will find fragmentation at the level of the retinal pigment epithelial with edema, which is telling that this is a CNV. This is also CNV. This is pigment epithelial detachment. This is the pooling, which is previously discussed. This is angioid streaks. You see, where there is things following the vessels. And yes, it is complicated by CNV. This is serpiginous choroidopathy, which is showing hypo-late staining. We know that choroiditis is characterized by early hypofluorescent. Sometimes they call it blocked fluorescence, and late staining. Okay, many of us is confused with choroiditis, all of us. So don't worry about it. This is also, you see, it's early hypofluorescence and late staining. This is serpiginous choroiditis. This is also fundus autohyperfluorescence with active lesion showing early hypofluorescence, late staining. This is white dot syndromes. You see the white dots areas, which is present in the fundus. With showing early hyperfluorescence lesion, which persist into the late phase. This is the only one who's showing early hyperfluorescence. This is a punctated inner choroidopathy, where the rims of hypofluorescence early and late stained around the disc. And multifocal choroiditis, you see? Focal point small choroiditis, birdshot choroidopathy. The lesion, all of this is under a very big entity called choroiditis. Thank you.